It's Breast Cancer Awareness Month, and all October long, we've shared stories of triumph and survival through amazing women in our community. But this morning, we're talking about one woman's unique journey after testing positive for a certain gene that made her say, you know what, I'm going to prevent disease. Christy Fott is here along with renowned plastic surgeon Dr. Franklin Rose to share the story. Good morning and welcome to you both.
Good morning, Melissa.
I'm thankful you're here because this is a conversation that women may need to have with their doctors and try to figure out where to come along. First of all, let's talk about this gene. People know it sometimes, BRCA, BRCA. We hear all the different words for it. BRCA. Can you explain what that is?
Well, it's sort of a series of genes. It's a familial or family type marker. At the time we did her surgery, it was not available. She has since tested positive. She can tell the story. Multiple family members have tested positive. She recently had a hysterectomy, oophorectomy, because there was concern at MD Anderson whether or not there could be potential issues down there. But she's been through a lot over the last 23 years, and she's done just great.
So 23 years ago, you decided that you were going to have a double mastectomy to prevent cancer. What was going on then?
I actually had fibrocystic disease, and I was very uncomfortable and very sick. A lot of times, I had maybe 1 week out of a month that I could actually be really active and normal. And so, me and my husband, due to the scans that were coming back and the fact that one of the cysts had turned to a solid mass, we decided that the best with my history would be to go ahead and do the mastectomy, and we had no oncologist that was willing to do it at the time. And so we found Dr. Rose because he was highly recommended, and he was wonderful, and he had mercy on my story, and he did everything for me.
Well, and it sounds like during that surgery you found out there was pre-cancer that would have turned to cancer. Correct. So it could have ended up saving her life. Let's fast forward to what just happened. You invited us to the operating room just a little over a week ago for you to undergo a new surgery, and we were thankful you were so brave to let us come in and witness what you were going through. But tell us about that journey.
So I decided that I would do the reconstruction again to update things. Things had gotten older, and make sure that everything was okay. And I had since tested positive for the BRCA 1 and 2, and so they wanted to make sure that everything was cleaned out and fresh, and so we did that, and now I'm all better and make sure everything is good.
Fresh implants. She had a prophylactic mastectomy, meaning about 99% of the tissue was removed 23 some years ago. She's been followed along, and because she had aged implants, we were able to put in some nice new implants. I might add, you know, her risk is down 99%, but when patients, maybe they need a breast reduction, maybe we remove 50-60% of the tissue, that also proportionally reduces breast cancer risks.
What do you suggest to women who are positive for BRCA? That's a big decision.
Well, first, I would say that the general public for women is 10% for getting breast cancer in their lifetime. So overall, you're not high risk. But whenever you test positive, if you test positive for the BRCA gene, I would say that your increase is from 50% to 70%, depending on your age. 50% is a lot. And then increasing that higher, I would say it's best to avoid it, because cancer takes more than you want to give. It takes a lot of physicalness, and people say, I don't have the money, I don't have the time, but you don't have the money or the time either to go through cancer.
Well, thank you for sharing your journey, both of us, and I'm thankful that you're doing so well.
Thank you.
She's
Take care of
great.
yourself.
Thank you.